Good day everyone! Welcome to the CSA Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. In today's episode, we have a special topic. It is the so-called sunken eye syndrome or hollow eye syndrome. And for some people, this is a common problem, having this volume loss under the eye and leading to a dark circle or a loss of luster or kind of like pigmentation under the eye. We have today Ma'am Cecil as our guest. Hello, ma'am.
Hello, Doktora.
Welcome po sa CSA. And of course, Dr. Nina Ong, our associate doctor. Okay, so Doktora, we've mentioned nga na for some people, this is their concern.
Yes.
Yung deep or sunken ang ilalim ng mata. And some are asking, ano kaya yung possible cause nito? Bakit nagkakaroon nitong malalim yung ilalim ng mata?
Yes.
Okay, Doktora.
Upon aging kasi, Doc, di ba magkakaroon siya ng sagging of your fat pad like this. So, of course, doon sa sagging na yon magkakaroon ka ng space. And then, yun yung parang lubog na nakikita.
Depression under the eye. Yes, isang factor yon. So, the aging process. Another one is genetics.
Yeah.
So, it could run in the family. No, mostly, mga Indians, I see most of them deep set or talagang hollow under eye. Okay, so yung genes po, ayun. And then, pwede rin sabihin natin may medical conditions, some hormonal problems.
Or pwede din sa stress, no? Yung activities natin every day. Kamusta naman yung
yun,
stress?
Common yan. Yung mga laging nagpupuyat.
Yes.
So, the lack of sleep. Yes, overwork. Si Ma'am Cecil, she's a nurse and a teacher at the same time. Nagpupuyat. So, maraming trabaho. Yan. Stress-induced also.
So much stress.
Kaya, pag nagpupuyat, even doctors, napupuyat din tayo. So, we get this sunken eye. Tapos, nagkakaroon ng darkening, ng pigmentation.
Yes.
So, there's this, yung mga tissue problem inside, yung paninipis ng balat, thinning of the skin. Tapos, beneath that, nabanggit ni Doktora yung sa fat tissues also. Sa fat tissue, pwede rin nag-atrophy. Aside from nagsasag na or humihina na yung orbital ligament. Tapos, yung muscular layer din, nagwi-weaken na rin. So, atrophy of tissues, yun yung sa aging process, kaya lumulubog, tapos volume loss, lack of hydration. May iba rin na hindi mapag-inom ng tubig, so parang lubog din, sunken din, dehydrated din. And yung iba, lack of nutrients, vitamins, minerals, attributing to this. Tapos dito, bakit nga ba naman nangingitim? And this is an area na maraming palpebral vessels. So, may tendency rin na mag-pigment. At saka yung pagkalubog, pagkasunken, tapos parang lack of hydration. Pag dehydrated yung part ng skin, ng area na yon, mas may pigmentation. So, the lack of the water moisture, mas may pigment. Tapos parang nag-create nung shadow effect. Kasi nga naman lubog siya. Tapos yung skin, nagiging wrinkly, corrugated, dehydrated. So, mas dark ang color. That's why when we do yung mga filler injection sa ilalim ng mata, pag pinil-in mo, yung mga lubog, tapos parang nai-stretch din yung skin, and then yung color, parang na-stretch mo, so medyo nagla-light yung color. So yung injection ng filler ngayon is for treatment na rin ng dark circles. Just like a balloon, di ba? Pag halimbawa ang balloon na ng kulay, for example na lang, dark blue. Tapos, wala siyang air. And then, you try to inflate it. Pag in-inflate mo, yung color, nagiging lighter. Yes. So, same thing with this one. So, pag shrunken or dubog siya, depressed siya, hollow siya, then when you inject a filler substance, so mag-stretch yung skin, ayun na, nagkakaroon na ng lighter color. Tsaka kung if you're gonna look around the eye area, yun nga, sa aging process, nagiging droopy na rin yung upper eyelid, tapos nagiging sunken from the lateral canthus to the medial canthus, causing or leading to ano na rin, volume loss, tapos pigmentation, yan. So, yun yung mga factors natin. So, of course, this one, a lot of people would wanna ask, ano po bang magandang treatment? Kasi marami dyan, they use mga home remedies, diba meron yung mga pipino,
Pipinong malamig.
or yung ano pa bang kinakabit nila dito? Tea bags, yung something like that.
Yes.
Tapos dito rin, for the pigmentation daw. Ano bang home remedy narinig mo, doktora?
Yun yung pipino, laging nilalagay yon. Or sometimes nga, para maalis yung pigmentation, doktora, nag-aano sila ng like calamansi.
Oh, mahapdi.
Oo. They thought that the
Especially
acid will react on the pigments.
Yeah,
para maglalighten. Para magpipil ba?
Right. Oo. Tapos the others are buying mga under eye creams, yung mga serum sa ilalim ng mata, they're also okay. Yung mga topicals na yon, just hydrate under the eye. There's nothing wrong with that. In our field, aesthetic medicine, so we also have a remedy. We have a procedure that we can do to correct this problem. Of course, you wanna look refreshed, rejuvenated, tsaka yung hindi tired look or haggard or stress. You wanna be refreshed and rejuvenated, and that is what we want to do for Ma'am Cecil right now.
Yes.
Okay? So mga kasesay, ating abangan ano po ba ang aming gagawing non-surgical procedures sa pagbabalik ng CSA Certified Skin Authority. And we're back mga kasesay. So we're at the actual procedure for the under eye rejuvenation or treatment of the so-called sunken eye or hollow eye syndrome. Okay, so again, going back sa ating under eye area, we want to do some landmarkings. Okay, the important thing to really check here is the orbital rim. Okay, so palpate for the bony part, okay, and then make a line there. Actually, sa under eye, so if one condition is depressed or sunken, the others naman, the opposite, eye bag naman.
Yes.
But then some people are like thinking of the eye bag, yung mga iba, dito lang yung puffiness nila near the lower eyelid. Actually, that's more of the eye roll. Okay? In other countries right now, they do injection of filler dun sa lower eyelid to have this so-called eye roll or charming eyes. It's in Korea. They call it egyoshal. Para daw charming eyes sila. So actually, they even inject filler na dito sa may lower eyelid region. Okay. But for the others, they don't like that. They wanna have this be treated also. So one way to have the parang puffiness din dito, kasi one factor is the muscle. So if you want to reduce that muscle there, you can inject Botox, okay, or neurotoxin. So another one, yung iba, the real eye bag is the puffiness below the eye roll, yung dito. So if there is a puffiness here naman, that's the particular eye bag, or we call it festoon. The scientific name is festoon. The others naman have this smaller bag here. So, dito naman yon. So, you've seen cases like that. For Ma'am Cecil, the condition is a sunken or a depressed eye, volume loss, or the thinning of the skin and the fats and also muscular layers. So, nagdi-decrease na. Yung kanya kasi, from the medial canthus, okay, going to the center here, up to the lateral canthus. So, you're noticing the entire length from medial to the lateral, may volume loss na talaga siya. So, we're noticing already some pigmentations also. And then, the skin, may konti na rin siyang wrinkling or some corrugations. So, the way to treat a sunken under eye, of course, you fill in. So, we have to inject a substance that will elevate it or lift it up. Para magkaroon ng volume, you restore the volume. At the same time, you correct also yung eyelid and cheek junction. Kasi depressed na depressed dito, tapos biglang umbok dito. And then we also wanna push the corner of the eye upwards like that to open her eyes. So we'll be using for her hyaluronic filler. For hyaluronic filler, we need light filler or light molecular weight. Hindi pwede dito yung mga thick fillers or heavy or large molecular weight fillers. Otherwise, it will form a bump or baka mag-sausage shape under eye. So, this is one thing that they have to understand. hindi pare-pareho din yung mga dermal fillers. They have different properties, molecular weight, concentration, and where should we place them, what anatomical depth. Merong superficial, merong medium, merong deep depth. Okay, so we'll be using lang light filler. And then take note, also anatomically, may mga danger zones tayong ina-avoid. So, sa area ng infraorbital, again, I've been mentioning about the infraorbital foramen here. Okay? So, this is always a no-go zone kasi merong neurovascular bundle. So, there's a nerve and a blood vessel coming out from this infraorbital foramen. And also, avoid this medial aspect. Meron tayong angular artery here coming from the facial artery here. So, yan. So, important landmarks, important anatomical structures to avoid. So, same thing sa kabila, Doktora. You can also mark the letter X, and this is a no-go zone when we do filler. Okay? So, for now, we'll be working on the under eye using our dermal filler, okay, hyaluronic dermal filler. And we have a new brand called Oriol. And it has 3 kinds of hyaluronics. It has the F, D, and G. So the letter F is for superficial layer, the D is for a medium depth, and the letter G is the grand, which is for the deepest or on the bone. Okay. So iba-iba po ang ating mga fillers. Okay. For Ma'am Cecil, I'll be doing a combination treatment. We'll be starting with the dermal filler. So, it's very important to clean the area. Okay. So, kailangan po sterile na sterile. So, I'm using a chlorhexidine to clean the skin, sterilize the skin. Okay po. So, now we have to make an entry point, a so-called entry point, because my technique will be a cannula technique. And normally when I make an entry point from the lateral canthus, make a vertical line and horizontal line with that of the alar groove. So this is my entry point and puncture only. And then I'll have my Oriol hyaluronic F plus because it's a fine hyaluronic and it has lidocaine with it. So, may kasama na siyang pangpamanhid. So, I'm using a soft cannula here. There. Soft cannula towards the third trough region, nasojugal groove. We need to correct that groove and the depression, the depressed part. Okay. So, be gentle in pushing the cannula. So, we have to respect some of the soft tissues inside. So, we have to be in a deeper plane or deeper anatomical plane. So, we're now in the third trough region. Okay, yung pong malapit sa medial canthus. And then, I'll just be pushing about a micro aliquot. Small amount only. Actually, when I do my dermal filler, less is more. And in pushing the product, it's better to be gentle. Don't be in a rush. Okay, so we just have to fill in the sunken part. So filling in to volumize, restore the natural volume, and also regenerate the tissues, the skin. Actually, the hyaluronic, Doktora, we know it's a water attractant.
So you need to drink lots of water after this one. To hydrate it also, no?
And my technique is I have to place the filler from this medial going towards the lateral. Kasi the sunkenness is the entire infraorbital region. So I will also go towards the lateral canthus here. Actually, when I fill this in, the lateral canthus, you give volume here. So na-fill in mo, it pushes the eyelid, upper eyelid upwards. So you're gonna also have a lifting effect on the corner of the eye. This one I can place 0.1 to 0.2 ml of my Oriol F+. Okay. So So this is a very good product because it also has a lidocaine with it. And they have studies that had proven their safety and of course their efficacy as well. Then after doing a filler, it's okay to do massage. Okay, to spread it. It has a good cohesivity, at the same time plasticity, or you can massage it or maneuver it to the desired shape you want. So more of filling in also the middle part. This is a 1 cc syringe, so we can give 0.5 here, 0.5 there. Okay. Again, I'll add at the middle part. Okay. So be gentle lang in pushing. Respect the soft tissues inside. So there you go. Actually, you can see the cannula if you pull it upward like that. So
we could see that it's superficial, doctor.
Yes, at this part where like this part I want to be more of a subdermal plane. I don't want to be very superficial because it's gonna create those lumps and bumps. Don't be too superficial because it could lead to the so-called, there's this Tyndall phenomenon that they call it. So don't be so shallow naman. Okay. Just the right depth. Okay. So we have done the dermal filler under the eye. Okay, on the right side. Okay. Actually, we still can combine with some threads. So we are done with the dermal filler under the eye at this side, right side. So we'll add threads for this area. And we'll show it sa pagbabalik ng CSA Certified Skin Authority. And we're back mga ka-CSA. So, we're now going to proceed to the under eye threads. We'll be using PDO Stellar PDO threads. Okay. So, we have injected lidocaine at the entry site, okay, and I have a gauge 21 for my entry point. Puncture lang po, 3 punctures at this column, and then posterior column, 2 punctures. Okay. Then I have my 25mm gauge 30 PDO Stellar threads, and then just insert towards the under eye region, infraorbital. So, this kind of threads, again, are PDO absorbable type of suture threads. And they have like a 6-month to 12-month absorption time. So, they will induce neocollagenesis, neovascularization, meaning to say, you'll build up your own collagen and you'll have better skin supply of nutrients. Okay. So, this will help in tightening and firming the skin, to prevent the sagginess and also to prevent the wrinkles. And since you are restoring your collagen, you're boosting your fiber formation. Okay, so these are biostimulants, so they're very biocompatible. Okay, I'm already on the posterior aspect po. So I needed to do an entry point, a puncture point, because this is made of a it's a tiny cannula, gauge 30. Okay, there you go. And then this is the second to the last, and one more. It's normal to see some pinpoint bleeding because we know that this region is also vascular. That's why we have to master the vascular anatomy of the face. The stellar has a spiral structure. So if you see the needle or cannula, the PDO threads are wound or in a spiral form. And it's a very thin, like a layer of our hair. That's how it looks. So these are stimulant of our fibroblasts. So I'm in the last part. Then we will be doing the left side. So we have done the dermal filler under the eye as well as the injection of the PDO threads using the stellar and the Oriole fillers. Okay, so let's show to Ma'am Cecil the outcome of our procedure for now. It's the mirror na po, Ma'am Cecil.
Wow! Iba na. Ganda po. Thank you, Doktora.
Yes po. So we've seen yung pasok ng dermal filler, it had pushed the skin upwards.
Yes, nagkalaman siya, Doktora.
Exactly. So the filler had stretched the skin, and I can notice also na na-lift yung corner ng eyes, plus the lid cheek junction naging smoother, and somehow it gave this good contour on the upper cheek, middle, anteromedial cheek area with our Oriole dermal filler po. And then the threads that we have used, those are protein threads, it will strengthen and also tighten and firm the skin para hindi na po siya mag-sag. So it also has a prevention na yung skin natin habang tumatagal naglalawlaw na, or the ptosis also. Yan. So
ganda.
I think instant din yung result. We can see an immediate effect already, an improvement. And as time passes by, lalo pa pong nag-i-improve. Mas nagiging finer yung skin, smoother, tapos nagiging hydrated with the hyaluronic, just drink a lot of water, and nadi-decrease pa yung pigmentation. Yan. And then home remedies na lang, Dr. Anong home instruction natin kay Ma'am Cecile?
Well, drink lots of water, then maybe you could rest after this procedure. And ano ba? Do we have medication?
Yeah, actually topical under
Topical,
eye
yes.
cream, we already prescribe po. Pag under eye pigmentation, vitamin K cream is good to lighten and brighten it up, or other depigmenting cream specifically for the under eye. Maganda yung may mga micronutrients, meron silang mga niacin, vitamin C. Those are good combination with vitamin K also para mawala yung pagka-dark circle. And adequate rest, adequate sleep, yan po. Kasi overwork din si Ma'am Cecil. Oh, ayan po. Thank you so much, Ma'am Cecil.
Doktora.
Thank you,
Salamat
Dr.
din
Nina.
po. Thank you
Okay.
po.
Sa inyo rin po, mga kasiyasay, maraming salamat po sa inyong panonood sa ating episode. Naway, nagkaroon kayo ng idea, ano pa ba yung pwedeng treatment for hollow under eye or sunken under eye syndrome. And these are safe techniques and clinically studied po yung mga hyaluronic fillers, PDO threads. They're very common nowadays. A lot of physicians na are doing it, not only abroad, maging sa ating bansa na po in the Philippines. And we're one of those who pioneered the thread lifting in our country. Yan. Kasi nagiging popular among doctors and among people na
Yes.
Nagiging nagiging aware na ang mga tao for mga techniques na non-surgical and less invasive and less yung mga risk compared sa
Less
surgical.
downtime also.
Yes. Yeah. By the way, ito po indicated dun sa mga may problems na mild to moderate. Kung talagang very severe, others will really need combination treatments. So, pwedeng may kasamang surgical, yung iba sinasamahan pa rin ng non-surgical. Ayan, maraming salamat po sa inyong lahat. Kung meron po silang katanungan, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Derm Centre, our Instagram, CSA Derm Centre. Our clinic is located here at the second floor, Pure Gold Building, Dauma MacArthur Highway, Mabalacat, Pampanga. Contact number 04533111117 or 0933-860-9193 or 0917-504 and 4286. I just check the screen, okay, sa ating mga telephone numbers. And ang aming mga videos po nakalagay sa aming YouTube channel. Only type Contessa Salvador, and please do not forget to click like and subscribe as well. So thank you very much. God bless you. When it comes to natural beauty, you can trust the CSA Certified Skin Authority.